Welcome to the medical school interview series that's going to help you get a spot into medical school. This is episode 1 of the series, and in this episode we're going to be talking about the ethical concept of euthanasia. We're going to be talking about, firstly, what is euthanasia, the different subtypes of euthanasia, and also the fors and against of euthanasia as well. So, what is euthanasia? Euthanasia is defined as the act of ending a patient's life in order to relieve them of their pain or suffering. There are 3 different subtypes of euthanasia that you should be aware of, starting with active or passive euthanasia. Active euthanasia is when, for example, a doctor does something in order to invoke the death of a patient. For example, gives them a drug that causes their death. Passive euthanasia is when a doctor, for example, takes away a treatment that prolongs the life of a patient. For example, they remove a drug that is keeping them alive. Next, you have voluntary and involuntary euthanasia. Voluntary euthanasia is when the patient has capacity to consent for euthanasia to be done on them. However, involuntary euthanasia is when they do not have the capacity to consent. For example, they're in a coma, so in that case, they do not have the capacity to consent for euthanasia. Our final subtype is assisted suicide and assisted dying. Assisted dying is when a patient has a terminal illness, and assisted suicide is when the patient does not have a terminal illness. Now, moving on to some of the fors and against of euthanasia. Starting with the fors. The first point that you should talk about is one of our 4 pillars of medical ethics, which is autonomy. Autonomy states that patients should have their own right to pick their medical treatment. Next, we have the low quality of life that patients are in during their time of having this terminal illness. Our third point would be that by having euthanasia legalized, it would allow patients to die with dignity in their own homes around their loved ones, instead of in a hospital setting. Finally, we have this moral dilemma of whether it's more humane to let the patient pass away, or if we should keep them alive in pain. Now we're going to move on to the against for euthanasia, starting off with another pillar of our medical ethics, which is non-maleficence. Non-maleficence states that we should do no harm. So by ending the life of our patients, we are in turn doing harm to them. Another pillar that we can link in is beneficence. Beneficence states that as medical professionals, we should do the best we can for our patients. So by ending their life, we are technically not doing the best we can for them. These 2 last pillars can be argued either way. Our final point for our against would be the funding and research in palliative care decreasing if euthanasia was legalized. Palliative care is end-of-life care, so by euthanasia being legalized, patients might turn to euthanasia rather than palliative care in the future. Currently, within the UK and in the NHS, euthanasia is illegal, so it's not permitted by the law. However, politicians are trying to pass an assisted dying bill, which will allow patients over the age of 18 and who have the capacity to consent and who are in the last 6 months of their life to request assistance from medical professionals to end their life. This is currently in its 2nd reading in the House of Lords. However, I'll put a link in the description down below that'll keep you guys up to date if you're watching this in the future. So, in this episode, we talked about euthanasia. So what questions could we potentially get in our MMI interviews that relate to the concept of euthanasia? So some questions could include, talk to me about something you've read in the news recently, or something that you've read ethical in the news recently. So in that case, you can talk about the assisted dying bill and link it in to euthanasia. Thank you for watching this video. I hope it has helped you prepare for your MMI interviews. If you want to keep updated with the other videos that I post, please drop a follow and also a like on this video, and I hope to see you in the rest of this series.